Yeah, welcome to ATV Africa, Nigeria #1 internet radio and web TV on education. Today, I just have a topic that I supposed to have a guest, but unfortunately, my guest could not meet up the time. So I decided to take this topic, and it's a very interesting topic. Top competitive medical courses to watch out for in 2025 and beyond. Top 5 competitive medical courses to watch out for in 2025. Every year, thousands of Nigerian students seeking admission through the JAMB and the matriculation board will hopefully gain admission into any universities to study any of these medical courses. But these medical courses we're talking about are highly competitive and market-driven courses. Now, when you decide to study any medical courses in a higher institution, all of us know that medicine and surgery is number one on the line. But the issue now is that these students also have the merit or they have the qualification to study this medicine and surgery. That's the question we should ask ourselves. Because every year when the JAMB matriculation board examination comes out, we see a lot of students filling for medicine and surgery. The majority of students we have nowadays, can they also write and pass the qualifying exam? That is number one thing. Two, even if gotten admission, can they go from year one to year five, even the medical school? These are the things we need to discuss on this our topic today. But unfortunately, like I said, my guest is not on seat. I will still bring this topic back when I have my guest or have another person. But briefly, I will just go to what are the qualifications to study medical courses. You must be a brilliant science student in the secondary school. You must be very good in your physics, your chemistry, your biology, also have maths and English. Gone are the days where they will tell you that science students don't need English. English is compulsory. Presently, English is compulsory and maths is compulsory for you to study medicine. But your sciences, like I said, physics, chemistry, biology, is a must. After having those subjects at the O level, you must have them at merit level, distinction level. Then you must write JAMB. JAMB is just Joint Admission Matriculation Board. Even presently, most universities will say you must score 280 above after your distinction in your 5 O-level credits. But there are some descriptions. Not only medicine and surgery we have in medical line. We have other like nursing, we have pharmacy, we have medical lab, we have a lot of them. I'll just go through some of these medical courses here and I'll give you what it takes. For you to study medicine and surgery, you must be above 16 years of age. That is number one thing. If you are not 16, you cannot write JAMB. Then you must have your A's in your science related courses. Then some university will still accept you even if you score in the JAMB, score 250, 260. That is also above the minimum requirement. Federal university will insist that you score 220 and above. State university will say you score 200 and above. So if you are in between this, you are good to go. But the rush for medicine and surgery also left untouched some other medical courses like pharmacy. Pharmacy is into drug manufacturing, drug prescriptions and healthcare system. So if you cannot meet up medicine and surgery, pharmacy is there for you to study. So it's also a nice course in medical line. Then we have this nursing science. The nursing science is the clinical aspect of medicine and surgery. They work and pari passu even at the hospital. A nurse cannot do it alone, a doctor cannot do it alone. And they are interwoven. So if you are a student who want to study any of these courses, you must also prepared for your husbandship and for your future. If you are the type that have a phobia for blood, have phobia for death, or you have phobia for people who are sick, sincerely, I would just advise you cross to other faculty of science because you cannot be a medical doctor and say you have a phobia for blood or a phobia for people, or you don't have a kind spirit to assist. Now, talking about the second one, I talk about pharmacy as the second most lucrative medical courses. Then the nursing science is the third most lucrative medical courses we have. So the next one is the medical lab science. Is highly lucrative courses now. This course came out from medicine. So we have it. So those are the ones you see that engage in medical testing. You have to go and do tests when you get to hospital. Go and do blood tests. Go and do urine tests. Go and do this. This science lab science people take care of that area. Why that of the SLT, Science Laboratory Technology, which is now in the university, formerly it used to be in the Polytechnic. They have a microbiology as a specialization option. They have a physics electronics as option, and they have a lot what they call it, chemistry as option. They also have that in Polytechnic. But some university today also are studying SLT. But we're not talking about SLT, we are talking about medical lab science, MLS, today. So MLS is also a very lucrative course. If you're medical line, you also want to study that course in 2025 and beyond. These are hot cake job that is out now. In fact, I just saw somebody a few days back who did biochemistry and is going back to universities to study this course. Though she's a young lady, she graduated at 20. She's also going to year two to study this medical science lab. No problem, because that's what she said she wants to do. In fact, I was even advising, I want to pick up a master's. She said no, she have age on her side, she wants to. So I will encourage our youth who want to study medical science, who want to study all these courses to please, you have to put on more effort. This is not a joking course. You don't just talk, you want to study medical lab from out, you have to study towards it. The next one I talk about five lucrative one is radiography and radiation science. Radiography also is another course that's lucrative now, very, very lucrative. In our normal palace, in our layman, we call it X-ray. X-ray. We call the X-ray people, but it's going beyond X-ray. This is the world of cancer. We are in the world of cancer. These people the people do research on this field. So these are courses that you need to be very, very aware of in 2025 and beyond. And these courses are highly lucrative. Then these courses are fully competitive, like I said earlier, and limited slots are available in the university. Yes. I presently today I was told at Osun State University that they have only vacancy for only 50 students to study medicine and surgery. That is it. Why? Because the medical association also regulates all these schools because of the research institution procedure. So not all universities will accept more than the benchmark. As a warning, they won't be able to take 100. So it's limited. It's highly limited. It's highly limited. So also nursing, pharmacy, medical science, radiography, and the list on that this thing is radiography. And for University of Lagos, as at last year, radiography, they said they only admitted about 210 students. That's the information. Maybe this year they will increase or reduce it, and nobody's. And majority of them, because they belong to the same faculty, College of Medical Science, they cross. So these are also. Then this medical courses are highly in demand. Highly in demand. It says students are experiencing medical courses as prestigious and well-paying career, which is true. Yes, they are well-paying career all over the world. That's why I say the moving of our nurses from Nigeria to Europe to America, medical doctor and stuff, leaving Nigeria because they believe they are not well paid. So it's highly competitive. It's true, it's highly competitive and highly in demand. Their professional qualification, yes, graduates can work in hospital, clinic, teaching research institute, and can even start a private practice. Yes, those are advantage of these professional courses. When you have the money, you can commence a private practice. You can commence private practice. Among these five courses I've mentioned, medicine, you have a clinic, a pharmacy, you have a pharmacy shop, and in nursing, you are permitted. A medical lab person also can permit it, and the radiography and radiation graduate also. They are professional courses that you can establish. They are professional courses that you can establish. All these courses ranges from 4 to 6 years. Yes, they are not courses of 3 years, 4 years. I think the least among them there is radiography and medical science, which is 4 years in the university. Pharmacy is 5 years, medicine is 5 years. Apart from the clinical and medical lab is also 4 years. Radiation science, radiography is 4 years. So it ranges from 4 to 6 years in the university, including the teaching hospital stuff. Like I said, they are hotcake all over the world, and job vacancies are sought for every year. Except they are not good in the job. They are well established and they get job as easy as anything for the good one. So in 2025, for our students who want to write jam, get more information, get more knowledge on these medical courses. They are highly competitive, like I said. It is not by saying by mouth, I want to be a medical doctor, or I want to be a medical scientist, or I want to be something else. So it involves knowledge, it involves you sitting down and read very well. And I think I'm done with these five competitive medical courses for 2025 and beyond. And next I come, I'll bring also other courses that we can do on AITV Africa. We discuss education here. We come here to give you the latest information and education. For our viewers, kindly subscribe to our channels on YouTube and other channels teaching we have. I wish you good luck. Thank you. Bye for now.